Gauteng Health MEC Nomathemba Mokgethi is today visiting the Hani Baragwanath Academic Hospital. This comes after the hospital staffers held a picket yesterday. Healthcare workers raised concerns over staffing challenges should the government not renew over 800 temporary COVID-19 posts. They warned that the termination of the employment contracts could lead to the total collapse of healthcare services in the province. For more on this, we now bring in our reporter Mbalenhle Mthethwa. Mbali, a very good morning to you. We saw a very disappointing and embarrassing state of affairs yesterday when it was revealed that the hospital, which is the biggest in the country, has run out of food. So what's the expected visit of the health MEC, expected to bring or change things around at the hospital?
Well, we're just moments away from that media briefing, and we are yet to hear what the MEC for Health in Gauteng will say about the situation that unfolded outside the gates of Baragwanath Hospital yesterday. We understand that there were some staffers who picketed outside the main gate, staged what seems to have been a lunchtime picket. They were there and quickly went back to their stations. You'll understand that being a doctor and a nurse is one of those essential jobs in the country where you can't leave sick patients alone for a very long time. Now, going back to some of the issues that were raised yesterday, it was the issue of a bread shortage. Now, you remember yesterday in the evening, we got a statement from the MEC's office talking about the fact that rather correcting the media reports around a food shortage at this hospital, saying that there isn't food shortage, but rather a bread shortage. We heard from the staffers who were picketing outside the gates here that they have not had bread delivered at the hospital for over 2 weeks, and part of the reason is that the department in the province did not pay the service provider. Another issue that was raised during that picket was the issue of medical waste, very important in terms of ensuring that hospitals are sterile and healthy places to work, and also for patients who are receiving medical care. They were saying that the medical waste has not been collected. Also, talking about the fact that, or raising concerns about the fact that a failure to pay service providers could be an indication of a collapse and could also trickle down to other hospitals within the province. You'll also remember that Charlotte Maxeke has not reopened since the fire, which means that various hospitals around the province have had to then pick up the slack and also had to deal with a larger number of patients without the hospital. And we understand that MEC for Health has allocated some funds to refurbish the hospital, but until then, these staffers are going to have to continue to work overtime. They raise issues, staffing issues, saying that even prior to the pandemic, this hospital was under-resourced, saying if these 800 staffers' contracts are not renewed, it puts the hospital at risk, and it puts them in danger of returning to that position they were in prior to the pandemic, saying that they do need the additional help and they need the extra hands, as in yesterday. We're unclear if the bread issue has been resolved just yet, and we hope to find out a little bit more from that. You also remember that yesterday we had some of the union representatives here also vowing to challenge the decision to let go of the over 800 employees, saying that they will stage a march on the 16th of this month. We will obviously cover that as soon as we have those details. But it seems as though workers and unions are united around the issue of workers and these contracts being extended. We also got a media statement from the office of the MEC yesterday saying that they did not have the funds to keep these 800 staffers on because they had initially received funds to deal with the COVID pandemic and have not received additional funds. This is despite health always receiving the lion's share of the provincial budget. And you'll remember that on Thursday, a large chunk of that portion of those funds was allocated and announced during the budget, the budget speech, which was delivered by the MEC for Finance at the provincial legislature. For now, though, it's back to you in studio. We will be coming back to you very soon with that briefing. We're going to be heading there to bring you the latest on what's happening here and all the developments. Back to you in studio.